guys heard of Bremelanotide or PT-141? Well, I'm Dr. Rina Malik, urologist and pelvic surgeon, and today I'm going to explain to you all about how Bremelanotide can be used to increase libido and potentially even help with erections. Bremelanotide is a melanocyte-stimulating hormone analog, meaning that it works just like MSH, and it's been studied for both men and women and is FDA approved for women with hypoactive sexual desire disorder, similar to that little pink pill I talked about in my last video. However, this is used as needed 1 hour to 45 minutes before sex, so an hour before you want to want. And interestingly, it works on the brain. So let's take it back. The melanocortin system is a group of substances. All of these things together control several different things, like how much we eat, how we feel pain, the color of our skin, and even our sexual activity. So very simply, melanocortins are excitatory signals that reach certain areas of our brain, like the cortex and thalamus, which then cause increased sexual receptiveness, meaning they feel more desire for sex when they are stimulated. And so scientists initially studied this melanocyte-stimulating hormone in animals, and what they found was that it led to increased sexual receptiveness, and it led to two interesting findings. One is that there was an increase of nitric oxide in the genitals, and if you're new here, I'll tell you that nitric oxide is the ignition for erections and sexual activity. It also led to dilation or opening up of blood vessels so that more blood flow was able to get to the genitals. And this then led to the development of Bremelanotide, also known as PT-141. And so as I mentioned, this has been approved for premenopausal women. And when they looked at women taking this medication under functional MRI studies, which means they could watch the brain change or light up different areas when the patient took Bremelanotide, they found that certain areas of the brain that were usually decreased in activation in patients who had hypoactive sexual desire disorder were activated, meaning that they were more easily aroused when approached with erotic stimuli. It also decreased activation in certain areas, allowing there to be less self-consciousness, and they increased some areas of connectivity in the brain, which may lead to, again, greater sexual arousal. So what they found is that in these women, they had increased sexual desire for up to 24 hours after taking the medication. They noticed that the increase in desire was seen in about 2.5 times more women than those getting a placebo injection or injection without any active ingredient in it. And interestingly, they also found that women had a little bit of decreased hunger when taking this medication.